Fibroids are smooth muscle benign tumors of the uterus that can occur in different locations. They can either be on the inside of the uterus, inside the wall of the uterus, the muscular wall of the uterus, or outside. Fibroids can be discovered during an infertility workup, either through a hysterosalpingogram or more commonly through a transvaginal ultrasound. Depending on either the size or the location of the fibroid, it may or may not be recommended to have the fibroid removed prior to beginning fertility treatment. Certainly fibroids that are very small and that are away from the lining of the uterus, most of us would say that those fibroids don't cause problems. Fibroids that are very large inside the wall of the uterus or even inside the lining of the uterus, most of us would say that those fibroids do need to be removed. The question really becomes, in a smaller fibroid that may or may not be close to the lining of the uterus, when do you remove that fibroid and by what means do you remove it? And that's a very controversial topic that needs to be addressed depending on your individual fertility history, what type of symptoms you're having, whether or not you've had previous miscarriages, and certainly your age. In a woman who's a lot older who has smaller fibroids, most of us wouldn't be inclined to take those fibroids out because of the delay in treatment that would ensue from the recovery of surgery. In a younger patient with a larger fibroids who maybe has had a miscarriage or two, I think most of us would be more inclined to take out those fibroids and allow you to recover before commencing treatment.